Hello, this is Stephanie Pearson, and I will be presenting on the trauma-informed classroom based on my studies in Concordia University, Nebraska's course, Education 695, Trauma-Informed Classroom. Heather Forbes, author of Help for Billy, explains that educators have to find a beyond consequences approach to helping challenging children in the classroom through a trauma-informed approach. This is because trauma affects students' physiological and psychological responses. By understanding the impact trauma can have on students, and in turn student behaviors, we as educators are better prepared to help students navigate reactions, responses, and regulation. The National Child Traumatic Stress Network found that 1 out of every 4 children attending school has been exposed to a traumatic event that can affect learning and/or behavior. Additionally, the Substance Abuse and Mental Health Services Administration's National Child Traumatic Stress Initiative found that more than 2/3 of children reported at least one traumatic event by age 16, and at least 1 in 7 children experienced child abuse or neglect within the past year alone, and that is likely an underestimate. With a significant portion of our student population experiencing trauma, it is our responsibility as educators to create a supportive environment that acknowledges and addresses these challenges, ensuring that every student has the opportunity to thrive despite their circumstances. Trauma-sensitive practices are approaches that recognize and respond to the impact of trauma on students' learning and behavior. They aim to create environments that understand, recognize, and respond to the effects of trauma through safety, trustworthiness, empowerment, and collaboration. Safety ensures physical and emotional security for students. Trustworthiness comes from building predictable environments with consistent boundaries. We can empower students by encouraging autonomy and self-advocacy. Collaboration happens when we foster strong relationships between students, teachers, and families. Kenton Livings defines trauma as anything that harms a person physically or emotionally, or that threatens that person's life. The American Psychological Association adds that trauma is an emotional response to an event or series of events that are deeply distressing or disturbing. Recognizing trauma's impacts help us in understanding student behaviors. This might be seen as difficulty concentrating, emotional instability, or behavioral issues. Traditional approaches in the classroom tend to focus on academic achievement, like test scores. This emphasis often neglects emotional and behavioral needs. Traumatized students already believe they are failures and unworthy, so failing grades and low scores only confirm these beliefs, sending traumatized students further away from attainable academic achievement. Heather Forbes points out in multiple chapters throughout her book, Help for Billy, that many traditional approaches to helping students with trauma actually have adverse effects and drive those students further into unwanted behaviors. This is often because traditional approaches are reactive and attempt to address the seen behavior instead of the underlying cause of the behavior. Misbehavior may be a result of trauma rather than intentional defiance, meaning we need to help the student regulate instead of punishing them for uncontrollable behavior. Additionally, traditional classrooms often lack the flexibility and understanding needed to support trauma-affected students, leading to increased anxiety and disengagement, making it difficult to accommodate diverse needs. Potential triggers or stressors also include standardized routines and environments, which can be distressing for trauma-affected students. These one-size-fits-all teaching methods may not meet the diverse emotional and academic needs of students with trauma histories. In creating a trauma-sensitive environment in the classroom, we have to address both the physical and psychological approaches. Starting with the physical environment, we need to design a stable and supportive space that aids in regulation and attempts to prevent triggers and stressors through safety, flexibility, and emotional support. When designing a trauma-sensitive classroom environment, there are a few things to consider. The space should be sensory-friendly. Even seemingly minor sensory inputs such as lighting and noise can overwhelm students with sensory sensitivities. Implementing sound-dampening materials or using noise-canceling headphones can help minimize auditory distractions and sensory overload. It should also offer other comfort and flexibility. Some students require more movement than others to stay regulated, and some require different textures or comfort levels. You can also ensure the classroom temperature is comfortable and consider the use of soft fabrics and textures to create a cozy, inviting space. Overall, the space should be designed for regulation. This might involve keeping wall decorations minimal and avoiding overly bright colors or busy patterns that can be overwhelming for some students. Next, we will look at a few specific options for a trauma-sensitive environment. Offering dimmable lighting or softer lighting creates a calming atmosphere and reduces anxiety and overstimulation. You can option out overhead lights for dimmable lamps, string lights, or natural light. I mentioned earlier that the environment should be comfortable and flexible. One way to achieve this is through different seating options. On this slide, I have 5 sensory-friendly options: a wobble stool, a tactile seat cushion, a floor cushion, which is similar to a pillow but much firmer, a yoga ball, and a beanbag chair. Each of these options offers something a little different for each student's unique needs. A final aspect we can add is our calm corner. This is a designated quiet space where students can retreat to for regulation for when they feel overwhelmed. On the slide and in my classroom, the calm corner has comfortable seating options, optional soft lighting, reminders they are loved, and an additional sensory or regulatory tools such as stress balls, poppets, and bubbles. Alongside a physically trauma-sensitive environment, we also have to consider an emotionally trauma-sensitive environment. Where the physical environment focuses on a safety where we do not want physical harm to come to our students, the emotional side focuses on psychological safety. We need to establish an environment where students feel safe to express themselves without fear of judgment or reprisal. The next key is inclusivity. We need to ensure that all students, regardless of their background or experiences, feel included and valued in the classroom community. Finally, we see emotional support again. In the physical sense, our classroom environment needed to support emotions through regulation opportunities. In the emotional sense, we as educators need to lead with empathy in all interactions, recognizing that every student's experience is unique and worthy of understanding. Another way to support students emotionally is through building strong, positive relationships. Positive student-teacher relationships are foundational to trauma-informed education, fostering safety and belonging. One way to consistently build positive relationships with all students is by implementing the 2x10 method. Spend 2 minutes a day for 10 days getting to know each student personally to build rapport. Make sure to maintain consistent positive interactions to build trust in a supportive classroom climate. Strong relationships reduce behavioral issues and enhance student engagement. By first creating an environment and culture that allows students to form strong connections, we can help mitigate the negative effects of trauma and enhance students' ability to learn and engage. Safe, consistent, and predictable relationships are crucial for trauma-affected students, helping them feel secure and supported. Implementing consistent routines and expectations can help foster a sense of stability, increasing students' trust and willingness to engage. Another thing to keep in mind when building relationships with students affected by trauma is that when they act out, it is often because of their trauma and loss of long-term thinking capabilities. We have to approach behavioral challenges with an understanding mindset, recognizing the role of trauma in influencing students' behavior. Challenging behaviors may be defense mechanisms, and educators should approach these situations with empathy and patience and not take everything the student says or does personally. In addition to the relationship between the teacher and student, consistent communication and collaboration with families are vital to creating a stable, supportive environment for students. This can also help create consistency between the student's school and home lives. Sharing relevant information with fellow colleagues will also help with consistency, stability, and support for trauma-affected students. Sharing relevant information like IEPs and 504 plans among all educators ensures that students' needs are consistently met. While collaborating with families and fellow educators, it is also important to be mindful of how we talk about or even to the student. The language educators use can either build understanding or create barriers. Using compassionate, trauma-informed language is essential in fostering a supportive classroom and positive relationships. Evidence shows that trauma-informed interventions can significantly enhance students' ability to cope with stress, leading to improved academic and social outcomes. Stability and engagement are crucial for fostering resilience in trauma-affected students. Classroom safety measures, which we previously covered, such as dimmed lights, calm corners, and flexible seating, can create a safe and nurturing environment that supports emotional well-being. Social-emotional learning reduces emotional tension and improves academic outcomes through regulation and resilience building. Incorporating mindfulness techniques such as body scanning, deep breathing, and sound meditation can help students manage stress and self-regulate. Utilizing restorative justice approaches, such as reflection journals and building strong relationships, can help repair harm and promote a supportive classroom community. I am also sharing some evidence-based, trauma-informed instructional strategies that align with trauma-sensitive approaches to enhance learning. We can tailor our own teaching methods to meet the varied learning styles and emotional needs of students, ensuring accessibility for all. By scaffolding, we can provide structured support to help students gradually develop independence in their learning, which is crucial for students with trauma. Also, in our planning and teaching, we can incorporate students' cultural backgrounds into the curriculum to make learning more relevant and engaging. Effective management is crucial for creating a supportive learning environment because it creates a safe and respectful classroom where all students can feel welcome. Clear, consistent expectations and positive behavior reinforcement reduces behavioral issues and enhances students' engagement. Implementing strategies that reinforce positive behavior rather than punishing negative behavior will help trauma-affected students most. These strategies also double to help strengthen relationships between students and teachers. Another important management strategy is having de-escalation techniques at your disposal. While not a preventative measure, training and methods to calmly and safely de-escalate situations when students are in distress is essential. Empathy has an important role in a trauma-informed classroom. It is essential for creating a supportive and connected classroom environment where all students feel welcome. It is also important to note that adults must also be prepared to change behaviors, assumptions, and beliefs to better support trauma-affected students by understanding that trauma can significantly alter a student's ability to regulate emotions, form relationships, and engage in learning. This awareness allows educators to respond with empathy and adaptability, creating an environment that promotes healing and resilience. A straightforward activity to also help students grow their own empathy is through role-playing, where they have to take on the perspective of others to better understand them. Supporting students' emotional regulation enhances their ability to manage emotions effectively. We can help students recognize and understand their emotional triggers and provide strategies to manage them effectively. We can also teach students healthy coping mechanisms, such as deep breathing, journaling, or talking to a trusted adult. One of the best ways to teach is by modeling, so we need to demonstrate calm, regulated responses to stress and encourage students to emulate these behaviors. Integrating movement and mindfulness into daily routines can also help improve students' concentration, emotional regulation, and overall well-being. Incorporating short, structured movement activities throughout the day can help students release energy and focus. Implementing mindfulness exercises, such as deep breathing or guided imagery, can help students manage stress and maintain emotional balance. In addition to implementing trauma-informed practices and principles, we need to assess their effectiveness to ensure they are meeting students' needs. We should be monitoring and collecting data on student improvement in academic performance, behavior, and emotional well-being. In addition to the data, we need to collect feedback from students, families, and staff on the effectiveness of trauma-informed strategies in their classrooms. Finally, we need to take all of this information and regularly review, assess, and adjust the chosen trauma-informed practices to ensure they continue to meet students' needs. Going beyond the walls of the classroom, building a school-wide trauma-informed culture can help students affected by trauma immensely. Instead of only one room being a safe space, all rooms can become safer spaces. This can be done through taking a collaborative approach by involving all staff members from administrators to support staff in creating a trauma-sensitive school environment. Implementing school-wide policies that reflect trauma-informed principles, such as positive behavior supports and restorative practices, will also help create consistent expectations and experiences across the school. In building the culture, it is also helpful to reach beyond the school walls into the community, partnering with families and community organizations to provide a network of support for students. Next, we are taking a moment to focus on you, the teacher. Self-care is not selfish. If we want to be the very best educators we can for our students, we also need to take care of ourselves. In addition to what is going on in our own lives, teachers are also taking home vicarious trauma. Working with trauma-affected students put us at risk of experiencing secondary traumatic stress. Being aware of this is a big step towards self-care. The next is intentionally engaging in self-care practices. We need to engage in regular self-care activities such as exercise, hobbies, or seeking professional support when needed. Another form of self-care is keeping ourselves educated for our own betterment and the betterment of our students. Professional development provides an opportunity for ongoing training and trauma-informed practices to equip teachers with the tools they need to support both their students and themselves. There are many ways this can be done, such as through workshops, seminars, and online courses, or independent learning through resources like books, articles, videos, or presentations like this one. Thank you for taking the time to learn more about a trauma-informed classroom.